women to get a mammogram. I know everyone is not a woman, but you should be encouraging your wife or any woman in your life really to get a mammogram yearly. Why mammograms are important? They reduce the risk of death by breast cancer by 25% with regular screening. Lumps can be seen 2 to 3 years with a mammogram before they can be felt by the patient through self-exam or a doctor. 9 out of 10 women have no family history of having breast cancer, and as you get older, your risk of getting breast cancer increases. The reason I'm interested in this subject is because, unfortunately, my mother died at 64 at what started as stage 4 breast cancer when she was 57. She had never had a mammogram, and when they found a lump in her breast, it was just over 6 centimeters, which was larger than the size of a lime. She had a mastectomy, and 16 of the lymph nodes they had taken out were of non-ovarian cancer. She was the first woman in her family to have breast cancer, so she had no family history. She went through 3 rounds of chemo in 7 years, and all of her doctors had told us that had she gone for regular mammograms, her chances of survival would have been much better. And like I said, my mother died of brain cancer at the age of 64, but she also had bone cancer and liver cancer. I'm sure everybody's familiar with the 4 stages of cancer. You have stage 1. Basically, the different stages talk about the different sizes of the tumors and whether or not there's lymph node involvement and whether or not there's metastases and spreading of the cancer inside your body. And just to get a visual on how large a tumor is, 1 centimeter is about the size of a pea, 2 centimeters is the size of a peanut, 4 centimeters is the size of a walnut, and 5 centimeters is the size of a lime. Stage 0, which was not on that chart, is the earliest stage of cancer. It's referred to as a tissue, which is in place. Basically, your cancer is just in one localized area. It hasn't spread. 15 to 20% of cancers that are detected by clinical exams and testing are in stage 0. And remember, the earlier the breast cancer is detected, the greater your chance of survival. Here's the 5-year survival rate by stage. You can see at stage 0, the survival rate is 93%. At stage 1, it's 88%. And obviously, it declines as the stages get higher. The 5-year survival rate at stage 4 is only at 15%. Okay, and the 5-year survival rate is, according to the American Cancer Society, refers to the average age or the average number of patients who are still alive 5 years after being diagnosed with a specific stage of breast cancer. The stats don't include women who have passed from the disease, and after 7 years, the survival rate declines for each stage. And it is important to say that women, even with advanced stages of cancer, can survive longer than 7 years. My own mother was diagnosed at stage 4 and survived 7 years, even though she was diagnosed at stage 4. Cancer statistics, according to the American Cancer Society, again, estimated new cases of breast cancer for women in 2016 will be just over 246,000, and men 2,600. And deaths in 2016 from breast cancer will be over 40,000 for women and 440 for men. Some men don't realize that they can get breast cancer, but they can. Women are obviously at 100% higher risk than men, but men can get breast cancer. So if there's a history in the family, you should talk to your doctor to see if you should be checked. The new guidelines for breast cancer screening that people are not quite so excited about, they are different than they used to be, and we'll talk about the old guidelines later. The new guidelines are women with an average risk of breast cancer, which are most women, should begin yearly mammograms at age 45. You should be able to start getting them as early as 40 if you would like to, but you should talk to your doctor to see when you should start yearly mammograms. At age 55, women should have mammograms every other year, which is very confusing to me because they say as you get older, your chances of cancer increase. So I'm somewhat confused by that particular new guideline as to why you only go every other year. Regular mammograms should continue for as long as the woman is in good health. And breast exams, either from a medical provider or self-exam, are no longer recommended. They used to recommend that women did monthly self-exams, but they don't recommend that anymore. Steps to take if you think that you may be at risk for breast cancer, or even if you may think you may not be. You should begin talking to your doctor about screening by the age of 40. If you have a family history, obviously you should talk to them sooner. Share all your family history and your personal history with your doctor so he can help you make a better decision and determine your risk for breast cancer. And understand the benefits, risks, and limitations of screening, and know that mammograms find most but not all cancer. Now we're going to talk about our friend Heather. As you know, we all work with Heather. She's our friend. She was diagnosed with breast cancer at the age of 35. And amazingly, she said her lump was no bigger than the tip of a pen, but it was found by her doctor during an exam. They sent her immediately for a mammogram, and she had her biopsy within 3 days. A lumpectomy was performed, and it was determined there were no clear margins, and a mastectomy was needed. And so we understand what clear margins are. When they take the tumor out, they take the tumor and some surrounding tissue. And the border of the tissue between the outer edge and the sample is called the surgical margin. All of that then goes to the pathology lab with a sample. They put a special ink on the sample around the outer edge. So basically, this is what they do. This is your tissue sample. These are the cancer cells here in the middle. They put this special ink around the edge. And in this picture, it has clear margins. It means that the cancer cells have not spread out to the outer edge of the ink area. There's 3 terms used to describe the margins, which is negative, which we just saw. There's no cancer cells at the outer edge of the tissue. A positive margin means cancer cells where the tumor has extended to the edge of the sample. The closed margin is anywhere in between negative and positive. Heather's take on avoiding a mammogram, and if you all know Heather, which we all do, you're going to know this is probably a mild statement from her. When I asked her what she would say to women who don't think that they need a mammogram or avoid mammograms, she said, "They're just I asked her, did you benefit from a mammogram? And even though her doctor had detected the cancer, she said, yes, she had. In 3 weeks from the time it was detected till she had her surgery, one of her lymph nodes had already tested positive for cancer. And she feels that without early detection, her case could have been much worse. The cancer probably would have spread rapidly, and she may not be the survivor that she is today. Cancer guidelines, as I said earlier, Heather, as well as some others, if you look out on some of the blogs and stuff out online, most people, especially cancer survivors, are not in agreement with the new guidelines. They're somewhat confusing. The old guidelines started yearly at 40, and they recommended self-exam. The new guidelines start at 45 now, with no recommendations for self-exam. And as we all know, Heather's very active in fundraising and speaking with cancer patients, and she feels that cancer could happen more now in younger women. She talks to some of these women, and a lot of women are younger, and that with these new guidelines, women may develop advanced stages of cancer since they aren't encouraged to go for screening quite early. There is new legislation being passed. It's called the Breast Cancer Density and Mammography Reporting Act of 2015. It was introduced in February of 2015 by Senators Dianne Feinstein and Kelly Ayotte, among others. I'm going to help doctors and women to understand that have dense breast tissue because it makes breast cancer harder to detect. It creates a national standard for written reporting language, and makes it easier for doctors to talk to the patient. It also encourages your research. And so, in conclusion, the biggest reason to get a mammogram, like I said, early detection decreases your risk of death by 25%, which means a longer life to spend with your loved ones, having time to do the things you enjoy, or giving you the chance, like Heather, to be an advocate, a support system, and an inspiration for others. Remember, early detection is the key to survival. And I want to thank you all for staying with us. Thank you.